Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and today we're going to look at a CML, a chronic myelogenous leukemia.
This is one of my favorite slides to look at. I like these.
I like these too. I like how you're done your diff in like 3 fields.
That's what it is. I'm lazy. It's the least amount of moving stage, right?
Well, that and I was saying earlier, I'm thankful that we have pointers
Yes.
so that we can find the cell that we're all trying to talk about together. But before we get into that, let's talk briefly about the patho of CML.
Yeah.
So CML is caused, well, most cases are caused by a recurrent cytogenetic abnormality, the Philadelphia chromosome, BCR-ABL, translocation of chromosomes 9 and 22. So essentially, the new T922 fusion that forms, gene that forms, gives us a fusion protein, the BCR-ABL, and it loses the ability, the protein in the cell lose the ability to regulate the regulation or how to keep phosphorylation from happening at a normal speed. So essentially we're able to phosphorylate these molecules and activate downstream systems at an extremely rapid pace, which we shouldn't be able to.
Mm.
And that allows us to decrease apoptosis, which means we're not having programmed cell death. So our cells are living significantly longer, reduce differentiation. So our cells are not maturing as fast as they should while we increase proliferation. So the cells are increasing and going through our mitosis significantly faster. So we're getting cells that are living longer. They're dying by necrosis rather than apoptosis because we're reducing apoptosis, and we're getting a lot of these cells, all because of this loss of control. We're regulating time and efficiency with phosphorylation. It's a pretty complex system and talking about downstream pathways and all of that fun stuff, so we won't go much further than that.
But yeah, 922, right?
Yep, T922.
So for those of you that are going to take a certification exam, you want those numbers and you want to associate them with CML.
Yep, CML, T922, Philadelphia chromosome, BCR-ABL.
Yep.
All of those. And usually your professors will harp on it.
I hope so.
Mm.
It's just easy points. You don't want to miss that question, that's for sure. Cool. So yeah, the presentation for these patients, many of whom show up to the doctor, maybe this gets caught totally incidentally. Um, Maybe they're feeling a little tired or they feel fullness, right? So we see splenic sequestration, right? A lot of these cells kind of getting trapped up in the spleen, causes splenomegaly and discomfort.
Yeah.
But yeah, I mean, uh, you
So
know,
in addition to that, when you have your body saying, I need more, I need more, I need more, remember that your spleen can take over hematopoiesis.
yeah,
And so not just sequestration, you also get hematopoiesis happening in the spleen, which enhances the splenomegaly
yeah.
more. So you have a really swollen spleen, and that's what causes that feeling that they're full, they don't want to eat anymore. It's an early satiety
Yeah.
that the patients usually experience.
Oh, that's interesting. Yeah. That's so that they feel satisfied
Yeah.
sooner than they normally would, right? So they're
Yeah,
eating
so
more.
usually the spleen pushes on the stomach, and so you can't take in as much food.
Mm.
So then you get weight loss.
Yep. But yeah, generally speaking, when this presents, they still have fairly normal platelet counts. There might be a mild anemia, but as opposed to like the acute leukemias where you have these dramatic presentations where these cell lines are heavily disruptive, it's not necessarily the case with this.
Well, the other thing, some patients with CML, they present with slight thrombocytosis
Mm,
in the beginning too. So they'll have increase that leukocytosis, the increase of their white cells, but they'll also present with a slight leukocytosis
mm,
in addition. And that's just because of the nature of these genetic mutations that can impact multiple lineages. And so
mm,
that's why we could see both lineages being increased, with, of course, the white cell lineage predominating.
mhm. Yeah. Yeah, CML is pretty cool. So yeah, where do we begin?
Pick a cell, any cell. Why don't we start with this one?
Okay, I like that one. So looks like a neutrophil.
Yep.
Um, it's just the nucleus is kind of folded in on itself, but we see pretty clear lobes.
Yep.
Granulation's consistent. I'm satisfied with the neutrophil call there.
Me too.
And then
This one
moving,
probably also.
yeah, maybe we could call all the, I don't know if you want to, yeah,
All the
we get a bunch of
neutrophils.
them. Yep. 100%. And the far left. Yeah.
Far left. Oh yeah. I was just debating about that one because it looks like
Yeah.
it's two lobes.
Yeah. 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 It does look a little less mature, but Melissa and I have talked about this before. Generally speaking, I'm very heavy on calling it a neutrophil as opposed to trying to force a band where I can't identify all the.
And this one, maybe it's a band, maybe it's just that it's like folded on itself like this, so we
Yeah.
can't tell. But because it looks like globulating, then I would go with the neutrophil.
Yeah, same.
Okay, now that we've got those out the way, why don't we hit this guy because he's fairly easy too.
Yeah, I like the easy ones. Easy, easy, easy. So this one's a classic promyelocyte. It's a beautiful promyelocyte.
Gorgeous.
You have a primary granules. You see them presenting on top of the nucleus. The nucleus has kind of a fine texture to it, owing to its general relative immaturity. You got a nucleoli there. Great cell, sort of.
Well, he's a beautiful cell, but
He is. He's still a beautiful cell. And then, do you want to move to the right of that?
this one.
Sure. So we see more maturity than the pro. So I'm kind of thinking like Milo-ish. It might be even more mature than that. What do you think?
I think it's on the line between a
Yeah.
myelo and a meta.
Okay. And then in that case, class, what would we do?
I would go with a meta.
We round up, right? Exactly. We always round up.
Yeah.
We'll go meta on that one.
Okay. Let me clear those arrows. And why don't we hit this guy?
Yeah, so this guy's kind of tricky. I'll explain like why this one kind of gives me heartburn. The cytoplasm, it looks nice and neutrophil-y. The nucleus is pretty clumped, but it's not like super clumped. This to me looks like it should be a neutrophil, right? But it's not. Jeez. You want to call this one meta or a Milo?
I think meta.
Yeah.
If you look, we're about this
Yeah.
for clumpiness in this.
And it's just
And
more clumps.
if they look similar, these two, and clumpiness to me.
Mm-hmm.
And then the other part then is if you look and you compare this to this, it's way clumpier.
It's way clumpier. Yeah.
Way clumpier.
Yep.
So we know it's not a pro. And also it's way clumpier than these guys. I know we haven't talked about these guys, but it's also clumpier than these. So I think the clumpiness is closest to this one.
And I think why you would compare those is we want to call Milo on those two, don't we?
Yeah. So these two right here, we would call them Milos. Now, this one has kind of a Golgi clearing right there, but I don't see a Golgi clearing on this one at all. And that's typical for malignant Milos, where we wouldn't see the Golgi clearing. So you can't rely on the Golgi to tell you that it's a Milo.
Yep.
We can talk about the last one in the bottom.
Yeah, sure. So I'm having a little trouble seeing good definition in the cytoplasm itself. But is this some kind of immature EO or something? Yeah, cool. So we see this too, where you'll see some immature forms of Bezos and EOs. Really, really common to see them in CML, right? Do you see? Yeah.
All the time. Immature EOs and Bezos are characteristic of CML.
Yep. So just, I know you're used to your bilobed EOs, right? But before an EO grows up into its bilobe form, it looks much like a lot of the granulocytic kind of lineage and progression.
Yep.
Goes for the number of granules too. You might have an EO that doesn't have like a ton of granules yet, perhaps. And so there's 2 of those in this field, right? So if we skip ahead and go up a little bit, yep, we have
Yeah.
another one.
Yeah, and so it depends on the institution. They may just say they may lump them under eosinophils and say that there's immature forms present.
Yep.
Or maybe they'll make you actually differentiate. Is it a myelocytic eosinophil, a metamyelocytic eosinophil?
If I were king and it was my lab, I'd say enough already. Put a comment in immature forms present.
Yeah. Yeah, but like this one, you can actually see a Golgi clearing.
True. I just always kind of, you know, we can be technically correct and more precise, but like, is that warranted, right? And I also try to think of how do you control across the laboratory, because having every tech proficient enough to make distinctions like that might be a tall ask. But
no, I just wanted to point out that there was.
Oh yeah, 100%. Yep. It's good physiology.
Yeah. So the immature eosinophils, and the only thing I want to point out about immature eosinophils is, remember the neutrophilic maturation sequence? The blast and the promyelocyte stage are the same morphologically between the basophil, the eosinophil, and the neutrophil. It's that myelocytic stage where you get the secondary granules, where you can tell lineage specific if it's a eosinophilic myelocyte or a basophilic myelocyte. Not that these are myelos, like this one is, but this one could be a myelo or a meta. But I'm just saying, once they get to the myelo stage and they have their secondary granules, that's when you can tell the lineage. Before that, blast or pro, we can't morphologically tell the lineage.
That's a good point. Okay, and then to the right of that, we'd probably go meta. What do you think? Yeah.
Yeah. I think this one's a nice looking meta. Like this one's like,
that one's awesome.
Classic meta.
Good job, you. And then
this one.
Same, right? I mean,
yeah, the chromatin patterns are the same.
That's what I'm kind of going off of.
Even though he's not quite indented yet, I still think he is.
Yeah, agreed. It's
here,
about best fit, and there might not be everything that you know that fits. And that looks like a good Milo, right?
It does, yeah. And if you look, the chromatin is more immature than the cells we just decided are the meta. So I just want to point out what Dave and I did was we identified the cells we knew and then compared the other cells to the cells we knew. So let the neighbors or the friends or whatever you want to call the cells help you kind of figure out what the next cell is.
Yeah. Don't make this job any harder on yourself than you need to. And I try to always stress that the context of the slide is really, really important. You know, there'll be times in your career where you got to identify that one cell, right? I'm talking to you, Cap, and you know, hopefully they give you a fair representation, but many times a lot of this is determinative of, you know, more the whole picture. So, and there's one thing I kind of want to talk, I don't want to start trouble. In the bottom left, does that look like a plasmacytoid lymph over there?
So is it a plasmacytoid lymph or is it an NRBC, like a very immature NRBC?
Oh, interesting. Yeah, it could be. Yep.
Because it's super round, but super round nuclei could be either.
Yep.
I do think it's more of a plasmacytoid lymph. I think it's what we would I think I just call it a reactive lymph.
Yeah, I agree. 100%. Yep.
He's not a plasma cell quite yet.
Right.
But it is easy to confuse with that immature NRBC as well. And I think the difference is I would still expect to see a little bit more purpley in the cytoplasm at that stage. So you'd still see some hemoglobin. And at that stage, the nucleus should be darker if it were an immature NRBC. So I think it's just a reactive lymph.
Yeah. Cool. Thank you.
And then, oh my God, reactive lymphs in CML.
Do you see reactive lymphs?
Sure can.
Well, I don't know. They touched a doorknob and picked their nose and they have a cold now, right? Like, I think we really do. You're never going to meet a patient that has one thing wrong with them. They're always going to have lots of different, the body's really dynamic and it's doing a lot of different things.
Yep. Yeah. And of course, these sorts of patients are going to be more prone to developing recurrent infections, so viral infections, bacterial infections, because, yeah, sure, their white cell count might be 100,000, but it's non-functional cells or abnormally functioning cells. They don't carry their full functionality. And so they're more prone to getting sick.
Yep, 100%.
Where is that?
So yeah, finding fields is really, really tricky.
I
Oh,
wanted to
cool.
pull these guys in.
Yeah, sure. So we got a baso and then an EO and
A baso here. And then you have this EO. Is it an EO or is it an immature EO?
well, yeah, I apologize. I'm being overly broad.
I think it's an immature EO.
Yeah, I agree. Yeah. I'm taking the Dave way out, the easy way out.
Be easy about it. Yeah, sure. Ooh.
No, thanks. I gotta go. See you later. I'm just kidding. I don't want to talk about the cell on the bottom.
Why not?
I just don't. I still want.
I saw it and I was like, I'm gonna keep it in the field.
Yeah, gross. See, if I were driving, I would have intentionally just tried to ignore its existence.
Well, I wanted to come to this field because of this beauty.
That is a good cell. That's a good cell. There's good ones here. Yeah.
Yeah.
I'll
So let's
joking.
point out the neutrophils first, I guess, again, right?
Agreed. Yep.
So we've got one here.
Agreed.
Here. Here. No, this
one squished in the middle there. Yeah. Yep. 100% agree.
Okay, so we got all the neutrophils.
What cell line do you want to do next?
Let's hit the basos.
Bezos, good. And oh, I see lobes in that one. Okay. So at first I was thinking that one might be a little less mature, but they both just looks like regular Bezos.
Yeah.
And
then this looks like an immature EO.
Yep.
And I know people are probably like, it just looks like a giant blob. Then it's challenging when you're looking at them. You really have to play with the fine tune.
Yeah.
And if you'll notice, that's why sometimes the screen goes in and out of focus, is because I'm playing with the fine tune as we're looking at this. But the nucleus is here. Ish. I'm a crappy drawer, but it's ish there.
Well, what's funny about it is like the granules are actually making it hard to kind of see the nucleus a bit, right?
Yeah.
So, and then right away in my mind, what cells have nuclei that are obscured, that can be obscured by their granules? And it's only a baso or an EO. So it becomes this kind of, binary choice. And to me, it's clearly not a baso.
Yeah, and it's clearly not, because this is what this patient's basals are looking like.
Yep.
Plus, if you were actually looking and playing with those fine tune, you can see there's some orange in there.
Yeah, there is, definitely. It's a little subtle though.
You want to do this one next?
Sure. So I think this one has some of the similarities, right? In our plasmacytoid looking cell, we have a basophilic cytoplasm, but I tend to kind of think this one looks more of the NRBC kind of look than its brother. Your thoughts?
Yeah, this one's kind of weird.
Yeah.
It's hard to tell. When I look at it in the scope, I think he's more of a reactive lymph, though.
Okay.
And then when I look at it here, it does look more NRBC-ish, but I still think when I look at it in the scope, the blue is too blue.
I buy that.
Too lymphy looking.
And then on reflection too, for the size of the cell, that nucleus would probably be a much more clumped if it were in fact an NRBC.
Yeah.
So
There's,
yeah, I buy that.
there's too many white striations.
Absolutely. But definitely a weirdish kind of
Yeah, he's
cell. Um,
okay.
all right, so we still have some boring ones, I guess.
Let's do that.
Okay. So the nucleus is now kind of off to the side, right? So we're thinking, what do you think, meta on this fella?
Yeah,
Yeah.
I think meta. It's eccentrically placed, and I feel like it's starting to indent here.
I agree.
It's clumpy. Okay.
So then moving over to that other bigger fella. Yeah, this one's kind of tricky because it's kind of like it's both clumped and a little bit kind of the nucleus is a bit stretched out, giving it a lighter color.
Yep.
But like I wouldn't feel like super confident calling this one a Milo.
Mm,
You know, I think I'd rather kind of err towards a meta.
yeah.
But I wouldn't fight with someone either, you know, like if they wanted to. So I guess I'm indifferent.
Yeah,
My
I could go with either for this one too. I was thinking about it and I'm thinking maybe it's a Milo just because it's so big and it was getting ready to go through mitosis.
Oh, that would explain the chromatin pattern, wouldn't it? Very observant. And so why do you say Milo?
Oh, so Milos are the last stage that go through mitosis. Once you get
Awesome.
to a meta, one meta equals one mature neutrophil.
Cool. Thank you for that context. That is a good point. And it does kind of look like it might be doing that. So every now and then, and it's usually in body fluids that I've seen it best, right? But when you start to see, you know, you learn all this stuff about mitosis, but you can see it practically in the scope sometimes. It's pretty wild.
Yeah.
And yeah, you can see that it's clumpy, but like, you know, separating from itself, kind of
Yep. Yep.
really cool.
So
And what about the blast?
now, is it a blast or is it a pro Milo?
Yeah, so and I think
That's what
the defining factor there would be the presence of primary granules
yeah.
in somewhat significant a degree, right? So if we just saw one granule, I'd still be more inclined to blast. So if Melissa could count the granules, what do you think?
Let's see. Oh
It's
no,
always better with eyes and scope, people.
there's a bunch.
Oh, there a bunch. Okay, all right. So then I would yield and submit to a pro myelocyte call. But it's close, right? This is definitely
Oh yeah.
a
It looks
young pro.
if you just look at this, it looks blasty. It's when you look here in this area that you're like, are those granules? How many are there? And it looks like there's a bunch. There is.
Yep. And I must admit that nucleoli is just beautiful.
Gorgeous.
Yep.
Huge. This one's nice and easy. You can't miss it.
Mm-hmm. Cool.
All
So
right.
that's good to see. And then that the good way for me to say, like, it is certainly possible to see blasts in CML. You may not see them also. So
Right.
it's kind of depends.
Yeah, it depends on where the patient is. With in different patients are going to have different numbers also.
Yep, definitely.
Remember, the definition of blasts is typically, or like the diagnostic criteria with blasts is usually in the bone marrow, not the peripheral blood. So we're looking at peripheral blood. So, you know, with CML, T922 is like the thing. It's diagnostic for CML. But like when you're trying to compare, is it acute or is it a chronic? The number of blasts is the distinguishing factor in the bone marrow.
Definitely.
Okay, we got a couple more.
We do. Kind of feeling Milo on this
Yeah.
fella.
Kind of feeling Milo on this fella.
Yep.
This
Yep.
fella. This fella.
I like that. Go
And then
for it.
this fella, I think so too.
Yeah. You should generally speaking try to have consideration for the pressures that are on the cell. So we can clearly see that a lot of these are all jumbled together. So that's going to influence the nucleus and how that looks. So and then also give yourself a little bit of slack too, right? About how you categorize.
So this indent is probably fake. It's probably because of the squishing.
Right. Mhm.
Maybe not, but the maturity looks similar to these.
Right. And then I always go back to clinical difference, right?
Yep.
If you change two of these cells to a category that's adjacent, it's not going to be consequential. Yeah.
Well, and again, it depends. Some institutions will have you call pro metamyelo, and
Hmm.
some will have you calling immature grants, and they'll
Right.
all
That's
three into
true.
one.
That's true. And in that case, you're gold.
In that case, you're just like, meh, 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 meh.
But also the point, like if it's 2% more Milo, less meta, and
Yeah,
then inverted, it's probably not going to make a big difference.
no,
So, but,
nope. Yeah. And we will distinguish for you just because we want you, the audience, to be able to distinguish in case that's what you're here for.
yep, true. All right.
We're going down, so let's go down.
Oh, did we find it finally? I think.
We found it.
Cool. So we have a ton of cells here, and we could go cell by cell on every field, but let's focus on what I believe to be a blast that we see on the left. Yes, perfect. Beautiful, beautiful. Very big nucleoli. The chromatin has got that perfect blast texture. It's consistent throughout. I see almost no clumping at all, right? It's that's a great, great blast.
Beautiful. This looks like it could be too. Again, it's just squished, like we were talking about the squishing.
Yeah. And I'm always partial to like the ones that are like demonstrably like that's this. So yeah, so then on the cell on the right, right? So 100% I would agree it's a blast. And what I'd start to look for is the primary granules, right?
Mhm.
To see what I see for primary granules. And I don't see a lot from this point of view. Do you? Yeah. So yeah, that's you can have two blasts right there.
Yep.
Yeah,
Yep.
it's
Next
awesome.
to an EO.
Yep. A cooperating EO. It's got
Yeah, he's a nice looking EO.
yeah.
Yeah. And then look at this guy.
Yep. I don't want
He looks like a megakaryocyte fragment.
I think that's totally reasonable. So that cell definitely, as many of these slides as I've looked at, there's definitely some that still make me uncomfortable, and that would be a cell that I'd get a little uncomfortable with. So that's great to kind of relate back to another video we did, right, on M7, that you can see these these meg fragments in lots of different conditions.
Yeah.
So
Whenever there's severe stress on the marrow, you can see them.
yeah.
And we already know CML impacts multiple lineages because you have your neutrophilic, your eosinophilic, your basophilic, and I mentioned earlier that you can have thrombocytosis.
Mhm. Yeah.
So, this patient could have the platelet lineage, megakaryocytes being involved as well, which you have your micromegakaryocyte fragments.
And there are quite a few platelets, aren't there? And I
Yeah.
just started kind of peeking at them. All right. What else do you think might be worth of time to spend?
Honestly, I think folks struggle with the immature grands, so I think even just talking about them would be helpful.
That's fair. That's fair. So
Hit this one.
that's beautiful. I would say we've comfortably transitioned to a Milo here. What do you
Yep.
think?
Yep. And again, we were talking about myelos going through mitosis. This feels like a larger myelocyte to me because this patient's myelocytes are like more like this size.
Hmm.
And so seeing a big one like this feels like he's getting ready to go through mitosis. The nucleus isn't as primed as the other one we saw, but definitely looks like it's a bigger one.
Mm. I actually got excited for another cell that's coming up.
Which one? This
The
one?
one to right more one more. I'm actually a little excited to do some measuring and some splitting of hairs on this one. Because I think you would probably have a lot of people argue about band or not. In all reality, I don't really care personally, but I think it's worth talking about a little bit. So we like to measure the indent in this situation. So a band should have an indent equal to its widest portion. Is that fair way to describe it?
So it should have an indent that's more than 50%.
Right. Okay. And then short of that, a indent less than less than 50% would indicate meta, right?
Yes.
So this one appears to be a meta by the standards that we've set out. But I'm sure there's a lot of people that might want to call this one a band, right?
By the hair of its chinny chin chin, it's
Right.
a
Yep.
meta.
Yep.
The other thing too, though, is some folks would call that a band.
I know. Absolutely. Yep. Yeah. And we just tend to. So for me personally, I see, and I might be splitting hairs here. Let me see if I can bring up. I'm slow to. Oh, geez. Where's my tools? Oh, there it is. So tell me if you agree, Melissa. But I see this little spot right there. I'm gonna clear. That looks like the pit of the indent. So for me, this is a neutrophil all the way.
Yeah. Also,
Um,
the two sides kind of look like they're doing this almost.
mhm.
They're scarecrowing a
Oh
little.
yeah.
They're not quite like nice and rounded like I'd like to see. So for
Mhm.
me, I wouldn't call it a band, but
Right.
some people would call it a band. And
Yeah.
whatever your professor or your institution standards are, that's what you should go by.
Yep. And I think you're going to see a lot of movement on this in the coming decade or so, where I think we finally make decisions about should we still be trying to split the hairs, so to speak.
Well, and a lot of institutions don't call bands.
I want to work those
I
places.
know, right? You just lump them into neutrophils.
I think there's a lot there can be a lot of clinical value in determining that there's a left shift to get early treatment to people that have infections. So I think that's where a lot of this want to be able to say bands and immature grands more precisely. But there's so many assays now, and we're getting so good at detecting infections and septicemia that I think it's just of less and less relevance, and we do better to confuse less people and standardize training and stuff. But that's my little rant. Sorry, that's not.
All right, let's see what else we can find. So many cells around.
There is.
Hard to decide where to go next.
And it also can be a challenge to find adequate fields, right? Like some of the fields might be a lot harder to discern what's going on. So do we think? I think Melissa saw a band. What do you? Or almost banned.
Oh, I was not looking for bands at all,
Oh.
but I was looking at the really nice promyelocyte here.
Mm. Mm.
And then I was looking at this thing.
Mm.
And I think that's a blast
Mm.
tucked with a baso that's completely squished.
Wow. That's cool.
It's really funky looking. Yeah. Yep. What are you showing me like this for like a band?
Hold on, here is like,
Oh,
you
I
know,
see.
and so what I see here, so it doesn't pass my smell test for a band, but I will acknowledge that the nucleus looks like rounder and there's less like twisty like lobe formation. But
Yep.
whereas the one you pointed to, it's almost making a C shape, like a crude C shape, but to our eyes, right, we see those sharp edges and we know that that's neutrophil
Yeah.
behavior. Band behavior.
And you know what? This guy here has a really nice Golgi clearing.
It does.
You see a nice
Yeah, there's some really good Milos. Like you could teach immature grands, I think, off of CML. What do you think? I
Oh,
mean,
absolutely.
it's not a bad slide to practice that on.
No, CMLs are great. Better than our M2 that we talked about with
I
all that
know.
dyspoesis.
I know.
Ooh. Some gorgeous cells here. So look at
Yes.
this really nice promyelocyte here. And really, our promyelocytes look like blasts with
Yep.
primary granules everywhere.
Yep. Yep.
And then this guy looks like a really nice blast, but he's got lots of nucleoli in here.
Yep.
Looks like there might be another one over here.
That cell underneath him too, huh?
Yeah. And it looks like there's a bunch of
That's
nucleoli there too.
yeah.
Maybe one here too.
So don't let that nucleus shape fool you there, right? So some people might start to think, oh, it's pinching in and it's bending, and I'm like, eh. So the pattern of the nucleus here is just all wrong for a meta. By the time we get to meta stage, there should be significant signs of maturity, and I don't see it there.
And so you want something like this more, or clumpy like one of these guys for a meta, over this. This is way too immature.
Way too immature.
And then you've got another really nice promyelo over here.
Pro.
And this pro, you can actually see the nucleoli.
Yep.
There's a bunch of them in there too.
Yep. It's a good slide. I love CML slides.
And then you have a couple of Bezos.
Bezos. Third one up top too, right? That's a little more washed out.
Yeah, so a couple of Bezos, and then you've got EOs over here.
Immature form up top. Oh yeah, no, oh geez, I didn't even see the one down there.
Yeah, mature EO. Yeah. Yeah, CML slides are awesome. They've just got so many interesting things. All right, let's look at one more field.
Sure.
All right. This guy in the center is wonky. You know what?
My gut instinct was pro, but it's hard to see kind of.
You know what though? I think he's an immature eosinophil. I think he's
Oh, no kidding.
the
I see it
myelocytic
now.
stage. Yeah. Even though he still has a nucleoli.
Wow.
So this
one
guy
fooled
has
me.
some nuclear cytoplasmic asynchrony.
That one fooled me, I'll be totally honest.
Yeah. No, looking at him briefly, I came over here because I thought he was a really good looking pro, and then I was like, wait a second.
That's cool.
Okay, so we've got some Bezos.
Yep. A few of them. Yep. Yep.
I think that's it. Yeah. And then just this one immature EO that we already pointed out. So let's hit up these immature grands then.
Okay.
Start with this one.
Sure. A little on the mature side. Would you go meta on this one, or would you just like Milo?
I'm thinking about it, and I'm just comparing it to all its friends. And like this guy's more immature.
So you kind of lean towards that meta, right? Yeah, so cell size is helping us here. The clumpiness of the chromatin is helping out. And so this is important, right? Because this is actually a pretty good like bellwether sort of cell here, where if I get to pick like, okay, I think I might want to call this meta, and then it makes some of the other calls in the field easier, right?
Yeah.
Like then they just kind of fall into place.
Yeah. So if this is a meta, this are all also metas because they have the same chromatin pattern.
Exactly. Yep.
Yeah, I think so. I think they're all metas. And then this is a Milo.
Milo.
And a Milo.
So let me twist your arm a little bit. Do we think that is there a mono in this pig pile?
This one?
Yeah.
No, I think he's part of this lineage.
Okay.
He just
I think I want to stretch there because of the nucleus a little, the shape.
The shape.
But the chromatin pattern is consistent with the grands that we're seeing. So
yeah. And I think this chromatin looks a little bit more mature than this,
Yeah.
but not quite as mature as that.
Right. Right.
So I think it's in between, so we'd go with meta.
Yeah. And it's what I love CML slides, but then the fact that they're all pig piles makes it tricky too, because I'm sure that it's getting influenced a bit by the cells around it.
Yeah, definitely with the squishing.
Mm-hmm.
And then just there's 2 NRBCs here
Jeez.
and here. All right.
This slide's been productive.
So I think one of the most important things people can take away is to identify the cell that you know and then use it to help you judge and gauge the other cells that are in the field.
It's a great point. Great strategy.
Especially with, excuse me, either newer laboratorians or students, really finding that one cell, like maybe they'd all look and say, I can tell this is a myelo. And then just go from there comparing. So knowing the characteristics and then applying them. So I think that's all we have for this video. So thanks for watching.
Yeah, thank you for your time. Appreciate it.
Please like, subscribe, and hit the bell if you'd like notifications whenever we post a new video. And feel free to reach out to us on social media or via email with comments or suggestions about future content. Thanks.